Now, what does that mean for people, for men who don't have any problem getting a blood flow, who get a perfectly good, hard erection on their own? What does that mean for them? What can it do for them? Does it make erections harder, longer, stronger? Viagra became FDA approved in 1998, a pivotal year in medicine. This revolutionized how we treat sex. And medications like Viagra have literally helped gazillions of men who otherwise cannot get an erection get hard every day in their bedrooms. Thank you. Thank you, Viagra and them, okay? Really has changed for the better how we treat sex and has opened the door for more innovations regarding the treatment of sexual dysfunction. Now, that's all good and great, but what we need to talk about, what's happening that is not mentioned oftentimes, is the recreational use or abuse, I should say, of Viagra. That is the use of prescription medications like Viagra for ED in men who otherwise do not have ED, in men who have perfectly good, hard erections and don't need help, but are using it to get a super erection, I believe, like mega erection. So let's get into what this means and what this might imply. So for those who don't know, what Viagra really does is it blocks an enzyme that breaks down a protein that promotes blood flow, okay? This protein allows your smooth muscles to relax and your blood vessels to dilate and allowing for more blood to flow. It blocks the enzyme that degrades that protein. Since it's blocking that enzyme that degrades it, there's more of that protein around, more of that blood inflow into the penis. And that's how it works. Now, what does that mean for people, for men who don't have any problem getting a blood flow, who get a perfectly good, hard erection on their own? What does that mean for them? What can it do for them? Does it make erections harder, longer, stronger? Well, we know the answer. In 2003, there was a double-blind study looking just at this very question. Now, double-blind means that both the people who participated in the study as a patient, the people who got the test medication, in this case it was Viagra, or placebo, they didn't know what they were getting. They just all got a pill. They didn't know what it was. And the people who gave out the medicine, okay, the doctors who participated in the study didn't know if they were giving the patient real Viagra or placebo. Double-blind studies are like the best type of studies to do because then it really eliminates the risk of bias since no one knows and they report their results without really knowing what they were given. So in this double-blind study, they had participants get Viagra or placebo, and these were healthy young men who had no erectile dysfunction, okay? They gave them Viagra and they evaluated what their response was. And so first question was there a better erection with Viagra? Was it harder, longer? No, it didn't change. Nope, erections was the same. Viagra didn't give a harder, more firmer erection in patients who already had normal erections. So they looked the same whether you got Viagra or placebo. Now, what they did find was that this refractory period, that's that refractory period from when a man ejaculates before they can come back for round 2, that period, that did shorten significantly with Viagra. So on average, it was about 15 minutes in this group. You can know that those are young men in this group because a 15-minute refractory period is already pretty darn good. Okay, so on average, 15 minutes before Viagra, down to 5.5 minutes on average with Viagra. 5.5 minutes. Now, y'all, please don't be trying to go out there and go abusing Viagra just to decrease your refractory period so you can go round 2, 3, and 4. Like, we don't need all that, okay? The more kind of disturbing side of this is that multiple studies have shown that the association of abuse or recreational use of Viagra with a high risk sexual behavior, meaning higher chance of unprotected sex, multiple partners. And therefore, there is been a multiple studies showing an increased association of STDs and HIV transmission with the recreational abuse of Viagra. Recreational use of Viagra is often combined with the use of illicit drugs, especially stimulants like meth and cocaine, in an attempt to have enough energy and stamina to go for very prolonged periods of times with having sex. A study of undergraduate men across the United States using recreational Viagra found the use of recreational Viagra was independently associated with increased number of sexual partners over the lifetime, an increased number of one-night stands, and the use of illicit drugs. Bottom line is, we all know the right answer. The abuse of prescription medicines when you shouldn't be taking them can have side effects, interact with other medicines that you may be taking, exacerbate medical conditions that you may or may not know exist in you, and put your body at risk. But more specifically, the abuse or recreational use of Viagra is associated with the increased risk of high-risk sexual behavior and STD and HIV transmission and illicit drug abuse. So keep it safe. Hope you learned something out there. Let me know what you think. Okay, no judgment zone. Right here, comment below and hit that subscribe button so you can join me every hump day with your favorite urologist right here. Take care, y'all.